Cortexin, a bovine brain peptide for the treatment of brain damage. Cortexin review and answering FAQs. What's up, nootropic enthusiasts? Welcome again to the series of our CosmicNootropic reviews. Remember our video about a popular neuropeptide, Cerebrolysin from Austria? This time we want to talk about its Siberian brother. So please welcome Cortexin. It's completely the same. Well, not exactly. But first things first. Let's begin by saying that Cortexin is a complex of low molecular weight neuropeptides, amino acids, and vitamins that is used for treating cognitive disorders. As you can see, similar to Cerebrolysin, Cortexin is based on neuropeptides and amino acids. However, there is a difference. Cortexin has a significantly larger amount of peptide fractions and fewer amino acids. Besides, while Cerebrolysin is produced from pig brains only, Cortexin is extracted mostly from the cerebral cortex of the young horned cattle. But which one's better? We'll get to that, but let's start with some history. It's interesting to note that initially Cortexin was aimed at treating military officials. It was developed in the Military Medical Academy in Saint Petersburg in Russia specifically for these purposes. But since 1999, Cortexin has been produced industrially through the patented technology, and now it's a popular peptide nootropic used to treat the brain. It's manufactured in the form of powder for solution for injections. I'm pretty sure you want to know exactly what you're injecting, so let's talk about Cortexin composition. As we've already learned, Cortexin is a bovine brain lyophilisate. It means that it's produced from the cerebral cortex. And the cortex is a highly saturated collection of various chemical structures. A complex and patented process of lyophilization is used to obtain such a mixture. This is a special method that helps to preserve the biological properties of substances. They say that the application of lyophilization also helps to significantly minimize the possibility of allergic reactions compared to the regular process of manufacture of medications. But what actually happens during the process of lyophilization? First of all, a lyophilisate is obtained from the raw substrates. A special process of soft drying of the substance is used for that. Then, the lyophilisate is frozen and then placed in a vacuum chamber. There, the drug transforms from a solid state to gas, bypassing the liquid state. Due to this, proteins and amino acids, which are the necessary components of the medicine, are preserved. It's very important because the effectiveness of the neuropeptide depends on the integrity of its structure. As we can see, the gentle and high-tech process of manufacture allows to make the mechanism of action of Cortexin very effective. Although the analysis of the pharmacokinetics of the whole range of substances that make up Cortexin isn't possible, the studies can single out a wide variety of substances in it. There are proteins in its membrane fragments and intracellular structures that include quite important ones. For example, calmodulin adenylate, cyclase, neurotransmitter enzymes, proteins of receptors and various kinase, etc., as well as vitamins, gangliosides, phospholipids, sodium, potassium, magnesium, calcium ions, and other elements. Polypeptides in Cortexin are small in size and weight, up to 10 kilodaltons. Due to that, the drug effectively penetrates the barrier between blood and cerebrospinal fluid that circulates through the brain. Thus, the drug reaches the nerve cells, or in other words, the neurons. Neurons communicate with each other using special substances called mediators. Mediators are peptides that stimulate or inhibit neighboring cells. Due to the fact that Cortexin has a similar structure, it triggers the release of the body's own peptides. As a result, the balance between different fractions of mediators is optimized. In particular, Cortexin peptides contain at least two stimulating amino acids, aspartic acid and glycine. The latter acts as a stabilizer. In addition to the mentioned above, there are many other amino acids in Cortexin. Check them out in the screen. Another important component of Cortexin are vitamins, in particular vitamin B1, B2, B3, PP, and niacin, as well as vitamin A and E. In addition to 5 essential vitamins, Cortexin contains many minerals in the form of macro and microelements. They include copper, calcium, magnesium, zinc, and many others that you currently see on the screen. There is reason to believe that the positive effects of the drug are explained not only by the action of the polypeptides of the indicated amino acid composition, but also by the neurochemical activity of macro and microelements and vitamins contained in it. You may think, oh, it's all very nice, but how can I benefit from Cortexin? Well, according to the manufacturer, Cortexin shows the following effects. First of all, neuroprotective. Cortexin is said to protect nerve cells from aggressive influences such as microbes, toxins, lack of oxygen, and so on. Then it exhibits regenerative properties, which means that it can accelerate the healing of damaged body tissues. Thirdly, as a metabolic drug, it may improve oxygen supply and neuronal nutrition. The antioxidant properties of Cortexin are manifested in its ability to slow down the process of fat peroxidation, during which free radicals are formed. Due to this mechanism, the resistance of neurons to the lack of oxygen increases. Besides, Cortexin exhibits anti-epileptic properties because it can reduce the likelihood of developing epileptic seizures. This is possibly due to the ability of the drug to normalize the ratio between excitatory and inhibitory substances in the central nervous system. Thus, the risk of developing areas of excessive excitement, which represents the basis of epileptic seizures, is reduced. And last but not the least goes its nootropic properties. Studies confirm a positive effect of Cortexin on cognitive functions such as memory, attention, and concentration. These processes function well if the nerve cells interact with each other effectively. Cortexin is known to improve this interaction. As you can see, the list of Cortexin benefits is quite impressive. Now, let's talk about its indications for use. Cortexin is frequently used in the treatment of various cerebrovascular diseases, including stroke and its consequences. It can be of benefit in case of inflammatory brain diseases, such as neuroborreliosis, encephalitis, and myelitis. Epilepsy is also included in the list of indications of Cortexin. Of course, Cortexin can be effective in the complex treatment of traumatic brain injury and its consequences, and other cognitive disorders which significantly affect everyday life of many people. For example, dementia, delirium, mental retardation, and so on. There are also some studies on using Cortexin as a post-COVID syndrome treatment. Now, let's delve deeper into the research of the treatment of cognitive disorders with Cortexin. There are a number of Russian scientific studies on the nootropic drugs that can put light on the subject. In fact, there is a whole book dedicated to Cortexin research. It collects works of over 40 authors who have shared their studies on Cortexin in neurology, intensive care, neurosurgery, pediatrics, psychiatry, and toxicology. By the way, if you are interested in scientific literature about nootropics, check out our blog post about the book on nootropics. It was written by the distinguished Soviet and Russian professor Dr. Arushanyan, and we translated it into English so that all the nootropic enthusiasts could have access to this unique information. But let's get back to Cortexin. Of course, in this video review, we won't be able to touch upon every single research from the book. I don't want to lull you into a slumber, but I'm pretty sure you would still like to hear about some of the most interesting ones. I bet you do. Well, one of the studies that is published in the book was conducted in 2012. It was a multi-center, randomized, prospective, double-blind, placebo-controlled study of the safety and efficacy of Cortexin in the acute and early recovery period of hemispheric ischemic stroke. We all know that stroke is one of the common causes of cognitive complications. The study enrolled more than 270 patients, and it was conducted in 7 medical centers in Russia that treat vascular pathologies. Cortexin was applied for 10 days in 2 repeated courses. The treatment was compared to placebo and a single course of Cortexin. The results of the study proved high efficacy and safety of repeated courses of Cortexin in comparison with a single course of treatment and with placebo. It was shown that Cortexin application contributed to both the restoration of daily activity and a more complete recovery of the patient's cognitive functions. The researchers who conducted the study concluded that it confirmed the high rehabilitation potential of Cortexin. The results are quite positive, right? But still, we have to say that the treatment of cognitive impairment must be comprehensive. When it comes to rehabilitation, patients need special exercises, classes with therapists, and so on. The support of family and friends is of great importance too. And nootropics such as Cortexin are just a part of the treatment process. There is also another interesting piece of research about Cortexin in the book. It was held in 2013 by the Russian researchers. They conducted a nationwide screening of the cognitive and affective disorders in Cortexin therapy of dyscirculatory encephalopathy. If you don't know what encephalopathy is, well, encephalopathy is a general name for a group of different conditions in which non-inflammatory brain damage occurs. The role of the main damaging factor is a metabolic disorder of nerve cells which leads to their death. So, the study enrolled some 50,000 patients who were diagnosed with dyscirculatory encephalopathy. It was developed against the background of arterial hypertension and atherosclerosis. The volunteers received Cortexin in the dosage of 10 milligrams daily for 10 days. The results of the study showed some good after effects. First of all, there was a regression of focal neurological symptoms. Secondly, the patient showed an improvement of cognitive functions in neuropsychological tests. Besides, the emotional state of the patients was normalized, and there was a decrease in the level of depression. I'd like to stress that encephalopathy is a serious neurological condition, but if the symptoms are noted early, there are better chances of recovery. Cortexin is one aspect of the complex treatment of this disease. That said, we shall also talk about dosing and how to use. We've already talked about it in detail in our Cerebrolysin video review, but there are some specifics to Cortexin, of course, and you want to be sure you're doing it right. First and foremost, please remember that we're talking about injections, and sterility precautions must be taken when you conduct all the manipulations. Cortexin goes in packs containing 10 vials with a powder for solution. There are two forms of release. Number 1, vials containing 5 milligrams of the active substance, which are mainly used for children. Number 2, and vials with 10 milligrams of the active substance for adults. The route of administration of the drug is intramuscular. Here the fun part begins, because you'll have to prepare the solution for an injection. To make it, you can use water for injection, 0.5% procaine novocaine solution, or 0.9% sodium chloride solution. I won't go deep into how to prepare the mixture, it's pretty easy, and there are clean and clear steps listed in the official instructions of Cortexin. You can check it out at CosmicNootropic.com. Don't worry, it's not difficult at all. As for the dosage, the manufacturer suggests the following regimens for adults. For general cognitive issues, Cortexin can be used in 10 mg once a day for 10 days. The course can be repeated in 3 to 6 months. In acute and early recovery after stroke, the recommended dose is 10 mg twice a day in the morning and in the afternoon for 10 days. The course is usually repeated after 10 days. Now, let's get down to your favorite part, answering frequently asked questions. The first one shall probably be about side effects. Let's look into it. Like many other drugs, Cortexin has certain side effects. It shall be noted that their incidence is usually low, especially if you strictly adhere to medical prescriptions, dosage, frequency of intake, and so on. There is no data on any particular adverse reactions to Cortexin. In addition, the careful process of manufacture also reduces the possibility of allergic and other reactions. However, being a drug of animal origin, it still poses minor risks of developing allergies. The degree of their severity can be different, from minor rash and mild stool disorder to generalized edema and anaphylactic shock. Therefore, the use of any drugs in persons with a history of allergies shall always be carried out with the utmost caution and after consulting the allergist. Pay close attention to the body sensations that may appear after the first injection. Another question that may be relevant is whether Cortexin is compatible with alcohol. In fact, Cortexin is widely used to treat post-withdrawal disorders and severe hangovers, as well as chronic alcohol intoxication and alcoholic encephalopathy. Besides, with the simultaneous use of alcohol and Cortexin, the damaging effect of the former on the brain decreases, and in general, the toxic effect of alcohol decreases. But the purposeful simultaneous use of Cortexin and alcohol is undesirable, since alcohol can still reduce the therapeutic effect of the drug. There is also an extremely popular question and a debate over what's better, Cortexin or Cerebrolysin. Let's get that figured out. In general, we need to understand that Cortexin is a nootropic that is usually used as part of the complex treatment of many neurological diseases. Because, as a rule, complex therapy is most effective in such cases. These are the drugs that Cortexin is often stacked with: Mexidol, Cerebrolysin, Ceraxon, Pentagam. As you can see, Cerebrolysin is one of them. Let's take a closer look at these two. Both drugs are successfully used in the treatment of neurological diseases. Their use in the recovery period after brain damages accelerates the recovery processes and promotes rapid rehabilitation. If we delve into clinical practice, according to the Cortexin manufacturer, it is preferred for depressive disorders, increased excitability, and fatigue, while Cerebrolysin is better for the treatment of dementia of various etiologies. In general, there are many discussions on the effectiveness of Cortexin in comparison to Cerebrolysin. Opinions differ, but it can be said that there are many positive reviews on both. To conclude, I'd like to remind you that the effects of any nootropic are highly individual, because metabolic processes can vary significantly in different persons. Besides, the use of any drug shall always be justified. Thoughtless use of medicines can cause harm. Only a doctor has the ability and training to prescribe any treatment or medication. Thank you for watching this video. Hit the like button if you enjoyed it, and don't hesitate to comment if you have any questions or thoughts about Cortexin.